Hi guys, this new video is gonna be about depression, the symptoms, and how you treat it. So yeah, let's just get right into the video. First question, what is depression? Depression, I have my side notes on my computer right here, so sorry for looking this way all the time. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. And fortunately, it's treatable. Depression causes feelings of sadness and or loss. Oh, sorry, or a loss of interest in things that you once enjoyed. It can lead to a variety of emotional and physical problems, and it can decrease a person's ability to function at work or at home. So now we're gonna move on to the symptoms. But it says here, depression symptoms can vary from mild to severe, and it can include feeling sad or having a depressed mood, which is, you know what that is. We all felt that. Loss of interest or pleasure in activities once enjoyed, what they mean by that is that if you enjoy playing the piano and then you suddenly don't want to play the piano anymore, that's what they mean. Or if you like soccer and then you suddenly stopped soccer practice because you can't do it. It also changes in appetite, like they mean weight loss or weight gain, unrelated to dieting. So it's not because you diet that you lose weight, but it's just because I think either you eat more or you eat less. And they mean, I can't really say that right. They mean it's not because you're dieting that you are losing weight. It's just because you might have a bigger appetite. You might have a smaller appetite. Okay, so trouble sleeping or sleeping too much. Trouble sleeping might refer to troubles getting to sleep, like you can't sleep at night, or when you finally get to sleep, you are awoken many times. Loss of energy or increased fatigue, which means that you kind of have a gray cloud over your head all day and you're just like, you're not up for anything, like you just can't do it. Increase in purposeless physical activity, which is handwriting or pacing or slowed movement and speech. These actions are observed by other people, so they can tell you like how you are acting. You can also have a feeling of worthlessness or guilty. You might be guilty over what you're feeling, like you're feeling sad, but then you think like kids and children are starving in Africa and I'm here feeling sad, and then you feel guilty for that. Difficulty thinking, concentrating, or making decisions. Yeah, that's just straightforward. I don't need to explain that. Thoughts of death or suicide. What they mean by that is that you might think about death a lot, or you might think about suicide. And like thoughts of death, like how it would be if you were not here, or any topics of that. Like I don't have depression, but I wanna tell you guys that every night I'm going to sleep, I kinda wish that I don't wake up. That's something that I have wished for many months, like almost a year. I have wished every night I went to sleep that I wouldn't wake up. But I don't have depression, I'm paranoid schizophrenic. Okay, so here's some statistics. Depression affects an estimated 1 in 15 adults in any given year. And 1 in 6 people will experience depression at some time of their life. Depression can strike at any time, but on average It first appears during the late teens or to mid-20s. Women are more likely to experience depression than men. Some studies show that 1/3 of women will experience a major depressive episode in their life. So here we come to how is depression treated. Depression is among the most treatable of mental disorders, which is great. Between 80% and 90% of people with depression will eventually respond well to treatment. Almost all patients gain some relief from the symptoms. But first we have how you can be treated for depression is medication. Brain chemistry may contribute to an individual's depression and may factor in the treatment. For this reason, antidepressants might be prescribed to modify one's brain chemistry, which I think they mean the mood. These medications are not sedatives, uppers, or tranquilizers. They are not habit forming. Generally, antidepressant medication has no stimulating effect on people not experiencing depression. So what that means is like if you have a person with depression and you have a person that does not have depression, the person with depression respond well to the treatment and you can clearly see a difference, where about a person without depression do not at all respond to that medication because they don't have the need to have that medication. Okay. Then we have psychotherapy or talk therapy, as they reference to also, is sometimes used alone for treatment of mild depression. For moderate to severe depression, psychotherapy is often used alongside with medication as antidepressants. Cognitive behavioral therapies and CBT has been found to be effective in treating depression. CBT is a form of therapy focused on the presence and problem solving. CBT helps a person to recognize disordered thinking and then change behaviors and thinking. Pretty self-explanatory. Then we have, and I have trouble saying this word, electroconvulsive therapy, or ECT. It's most known for ECT. It's a medical treatment most commonly used for patients with severe or major depression or bipolar disorder, who have not responded well to other treatments like medication and psychotherapy. It involves a brief electric stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. ECT has been used since the 1940s, and many years of research has led to major improvements. What was that? It is usually managed by a team of trained and medical professionals, including a psychiatrist, an anthropologist, and a nurse or physician assistant. And that was actually it. This video was a little longer than I expected, but I hope you have got some answers from this video, or if you didn't see a question answered in this video, please comment down below and I will get to your questions when I can. So thank you guys very much for watching this video. Please leave a like, please subscribe, and hit the notification bell so you don't miss out on any of my videos. Bye!